Hello, I'm Dr. Darren Scott, and I've been practicing and treating chronic health conditions for the past 10 years. I also consult with over 800 doctors throughout the countries that treat these same kind of conditions. Now, my purpose today is to discuss thyroid metabolism, specifically the unresolved thyroid, and how you can change your life with the information we're going to discuss today. Now, you may ask, what makes us different than everyone else? We're different because we treat you metabolically and neurologically, and we do not use pharmaceuticals. You're watching this video because you or someone you know has been suffering from a chronic thyroid condition. And what they're doing now isn't working, and they're looking for alternatives. I will tell you this: we will leave no stone left unturned to find the exact cause of your problem. Now, I get questions all the time. Dr. Scott, how is it that you're able to help thyroid conditions? Well, specifically, what we do is we test metabolically and neurologically, and then we treat metabolically and neurologically. So let me ask you this question. How long have you been suffering from your condition right now? What will happen if you stay on the current path that you're on right now? How much money, how much time, how much effort have you put into your condition at this point that really aren't working? And lastly, what is it worth to you to fix your problem? Now, the reason why I ask you these questions is because chances are you've been probably dealing with this condition for years, if not decades. Now, if you stay on this same path and nothing changes in the next 5 or 10 years, what do you think is going to happen? I'll tell you, nothing's going to happen. Nothing's going to change. If anything, it's going to get worse. Now, I also ask you this because the current treatment you're doing right now obviously isn't working. I know that because you're watching this video right now. Now, what I'm going to do today is I'm going to share with you some life-changing information and how you can get rid of your condition. Now, the current medical approach to thyroid treatment is basically based off a 1960s model. It's old medicine. Nothing has changed from 1960 to now for the traditional treatment of thyroid. It's basically hormones. Okay, and also the research that's done on a lot of the thyroid treatment is funded by pharmaceutical companies. So obviously, it's all about taking drugs for your condition. And we all know they don't work. I know this again because you're watching this video right now. And again, the definition of sanity is this: if you keep doing the same thing over and over and over, expecting a different outcome, that's insane. That is insanity. Because the best predictor of your future is your past. If it's not working for you now, what's the chances of it working 10 years from now? None. It's not going to work. I know you've been on this medical merry-go-round, and it's been going on for probably years now. But what I want to talk to you now is about functional medicine, 2011 functional medicine. Now, I'm not talking about taking pharmaceuticals. I'm talking about specific metabolic protocols and testing that actually do work. Now, what I want you to do at this point is go ahead and stop the DVD. I want you to go get a pen and a paper because we have some important things for you to write down. Now, how do we know what the problem is? That's the magic question. And I'm going to say this over and over to you, but the only way to really know what your problem is to run the appropriate tests. Not just running tests, but you got to run the appropriate tests. Now, there are 6 basic patterns that will cause your thyroid to malfunction. And only one of those patterns actually are helped with the hormone replacement. If you're that pattern 1 that is affected by that hormone, you'll have a good success, which means you'll take the medication and your symptoms go away. You have no more problems. Voila, you're good to go. The fact that you're watching this video, obviously you must be having some symptoms, which pretty much indicates to us that is not your category. And we'll discuss the 6 different categories for you. But I'll tell you this, the secret to your thyroid and to helping your thyroid starts at the dinner plate, not the medicine cabinet. Now, let's cover some important principles that I think you should know. Now, the first thing is this: every cell has a thyroid receptor. From the tip of your ear down to the tip of your toe, there's a thyroid receptor in every one of those cells. Now, every system in your body will actually slow down when you have a thyroid problem. And I want to tell you, you have symptoms because you are sick, not because you're sick because of your symptoms. Now, every system, including your bone metabolism, your GI tract, your reproduction system, which a lot of people actually have fertility problems because of this. You can, your gallbladder, your liver, your fat burning. People with weight gain and thyroid problems really go hand in hand. If your body slows down and it slows down the ability to burn fat, guess what's going to happen? You're going to gain weight. Insulin, glucose levels, and brain chemistry. Now here's what I mean by brain chemistry. Now do you ever walk into a room and go, man, what am I doing here? I can't, okay? Or you get lost in conversation. If you find this is happening to you, you are already having brain malfunctions. And it could be coming from not necessarily your thyroid, but the problem that's causing your thyroid to malfunction. Now let's discuss some lab results, okay? Now I want to hit the basics here, but once we go through this, you'll have a little bit of an understanding of you can pull out your lab reports and you'll be able to look at your specific tests that your doctor's ordered or the tests he didn't order and be able to kind of see where you are generally. So the first thing I want to talk to you is the master hormone that everybody checks is the TSH. That is the thyroid stimulating hormone. This is normally pulled every 6 months when you have a thyroid condition, traditional medicine-wise. This is the hormone that pretty much the only thing that they run. They may run a TSH and maybe a free T4 or something like that, but they base just about everything. Your thyroid medication to go up or down is based off your TSH. And when we're done explaining how the metabolism of your thyroid works, you'll understand why that just is insanity just to go off that one hormone. Now, T4. 2011 medicine, 6 to 12. Now, traditional medicine from 1960, guess what? 4.5 to 12.5. Now, T3. T3 is the active form that your body can actually use. This is the normal value is 300 to 400, or the 1960 value, 230 to 420. The last value I'm going to cover with you is TBG. That's thyroid binding globulin. That should be 18 to 27, and that value in 1960 was 10 to 24. And again, I gave you the 1960 values because that's what the current doctors are using right now to determine your care and your treatment. Now, go ahead and take out your lab results. See what you find. You'll actually probably be pretty shocked that probably your doctor only ordered TSH, and if you're lucky, he did a free T4 test on that. All right, now let's move on. Let's talk about the actual how the thyroid can malfunction, okay? So let's go through it. Okay, so when your TRH is released, that stimulates the pituitary gland to release a hormone called TSH. That sounds familiar, right, from the lab test that we just discussed. That is the thyroid stimulating hormone. Now, that will in turn make the thyroid produce two hormones, T4 and T3. T3 is the active form that the body can actually use. T4, the body can't use it. And we'll discuss that the body actually has to convert T4 into T3. Now, the numbers next to the T mean basically this. That's how many molecules of iodine are attached to that hormone. So T4 has 4 molecules of iodine, and T3 has 3 molecules of iodine. And so what the body actually has to do is the body has to cleave off one of the molecules of iodine, T4, and turn it into T3. So what will happen is these two hormones, the T4 is actually sent to the liver for conversion. Now it catches a ride with that TBG that I talked about. Think of the TBG as like a taxi cab. These hormones need to get throughout the body, they need a ride, okay? And they catch a ride with the taxi cab. They actually bind to that, to the TBG. Now, one thing with the T4 is this. T4, 97% of all the hormone from your thyroid is T4. Only 7% is the active form that the body can actually use. So you can see the majority of the hormone that your body uses is converted somewhere else, not in the thyroid. And so what will happen is the T4 will catch a ride with the TBG and it's sent to the liver. 60% of all T3 or 60% of all T4 converted to T3 happens in the liver. 20% of all T4 converted to T3 is actually converted in your gut. And the rest of it's done within all your tissues and in your cells. So you can see if you have a liver problem or if you have a gut problem, it very well could affect the thyroid function. Okay, so let's go over the 6 different patterns that cause your thyroid to malfunction. And we may get a little bit of an idea kind of what pattern you may be in. So pattern number 1 is this, primary hypothyroid. Okay, what happens is this, is the thyroid gland gets lazy. All right, and so what happens is the pituitary gland in turn kicks up more TSH because that's the hormone that says, come on, that's, you know, it kicks the thyroid in the pants. So you're going to have an elevated TSH with this, all right, and the thyroid's not going to work. Now, here's what's going to happen. This is the pattern that hormone works. You don't have the hormone, you take the hormone, bam, your symptoms go away, and it's actually, you get some pretty amazing results if you're the pattern 1. But unfortunately, you have an 83% chance of that not being the case. So, now let's go to number 2. The second pattern is hypothyroid, but it's secondary to a pituitary gland problem, which means now the pituitary gland here gets lazy. Okay? That gets lazy, and so that is the actual problem here, not the actual thyroid itself. Now, what are some of these causes that will cause this to happen? Chronic stress. Chronic stress and fatigue is a big one. Okay? Some other causes are the hormone pill. Okay? Even Synthroid can cause the pituitary gland to have a problem. Different hormones like creams that have estrogen. And don't forget the women that your makeup actually has hormone in it as well. Postpartum depression. Okay? Pregnancies, they can fatigue that pituitary gland 24 hours a day, 7 days a week. Even fluctuations in your insulin and glucose levels will affect it. Now, why do you have such a influx of the glucose and insulin? Well, what will happen is because of our standard American diet. Okay, it's terrible, so that's where we're going to have all sorts of problems up and down with your glucose. Now, what maybe that you've been putting in your mouth for years could be very well causing your thyroid symptoms, and that's what we're going to have to change. Now, number 3 is the thyroid underconversion. Now, with this one, guess what? Your TSH is going to be normal. All right, so if you're only running a TSH, that's why you're not going to be able to pick this pattern up. Now, what we have to do is we have to run an add-on test to see how much T4 is actually, what T4 is doing in the body. Now, with this pattern, what happens is the thyroid gland produces plenty of T4, but there's the problem with the converting of the T4 to the T3. Now, why does this happen? Okay, chronic adrenal stress. If you're under chronic stress, what will happen is your adrenal glands, they sit right above your kidneys, they will produce cortisol. And then what cortisol will do is cortisol will actually suppress the ability to convert T4 to T3. Now, 60% of the conversion's in your liver, right? And 20% is in your gut. So again, if you have a liver problem or a gut problem, that's probably the problem and not your thyroid. Now, think of it this way. Has anyone ever told you anything that we've just discussed with you? Even with your gut, your thyroid, or whatever. Okay, they're just not telling you that. Okay? Now, the problem why no one's saying anything to you is because in the medical world we have like specialists, right? We have a gut specialist, we have a liver specialist, we have a thyroid specialist, we have a brain specialist, but no one's really put everything together. And as you can see, everything is connected. That's why you have to look at the whole picture, not just one lens of it or one little part of the picture. Now let's move on to number 4. The 4th pattern is thyroid overconversion. Now, what we need to see here is how much T3 we have in your system. Now, commonly, this is missed because T3 is generally never ordered, okay? Now, with this particular condition, there's too much conversion going on, all right? And there's too much T3. And what happens is it overwhelms the system and your cells, and it gets resistance to it. Now, why does this happen? One cause is insulin resistance, okay, especially in women. And this can actually develop into what they call the PCOS, the polycystic ovarian syndrome. Okay? Now, category 5 is thyroid or elevated TBG, that thyroid binding globulin. Remember, those are the taxicabs, okay? Now, what happens again? The T4, T3 has to catch a ride in the taxicabs. Under this pattern, what happens is there's too many taxicabs. Everybody can get a ride. And so when all the hormones can get a ride here, what will happen is they like to get a ride and they don't like to come out. They enjoy the ride. They don't want to pop out. And so the hormones don't get into the cells. Okay? Now, what can happen with this? Oral contraceptives, hormone replacement therapy. You know, those are some causes, and if that's the case, it's very important that we need to address antibodies. Antibodies are basically, we're looking for autoimmune problem as well. Now, the sixth pattern is actually thyroid resistance itself. The pituitary and the thyroid levels are normal, but hormones are not getting into the cells for whatever reason. Now, some of the causes of this is, number one, again, chronic stress. You know, you can have chronic inflammation. You can have a homocysteine problem. So my question is this: what pattern are you? And how do we determine what pattern you are? I bet you know the answer, but I'll tell you, is we have to run the tests. I know I've said it before, and I'll say it again. We just have to run the tests. It's the only way to know and not guess. Okay? One thing for sure, though, is if you're watching this DVD, we know you're not pattern 1. Again, if you're pattern 1, you take the hormone, you feel good, you feel great, you feel 100% normal. Chances are that's probably not the case here. Now, also, there's a 70% chance that you have an autoimmunity problem and not actually a thyroid problem. 70% of all thyroid dysfunction is autoimmune. Okay? Which means this: it means your own immune system is attacking your thyroid gland and it's destroying the thyroid gland. Now, 15% of you will fall in pattern 2. Another 15% will fall within all the other patterns that we discussed. Now, how do we know? Okay, how do we find out which pattern? We got to run the test and see. So here's what we do: is we will run a complete metabolic panel. We'll run a complete thyroid panel, which will include not just a TSH and a T4, but we run all the other complete thyroid hormones and markers that we need to assess your condition. We will also run an immune panel. We need to know if you're autoimmune. We'll do some sensitivity testings. We'll also do an ASI test, which is called an adrenal stress index. Okay, and we'll kind of go through each one of these. But by using these tests, we can actually assess your adrenal glands. We can assess your white blood cells, your red blood cells. We can address any other problems that you may have so we can help you heal you faster. Okay? We'll also assess your glucose levels because your brain needs glucose. All right? It's fuel for your brain. Now, with your hormone panel, now we're going to test for some specific antibodies. Now, there is a test we're going to run for your thyroid that we will know for 100% sure if you have an autoimmune thyroid or not. No questions, no debates about it. Okay? The other thing we're going to do is we're going to do sensitivity testing. All right, we have a stool sample that we'll do. It's a home kit. You don't do it in the unit, but it's a kit that you take home. We're going to test specifically for wheat and for milk. We'll do some other things, but those are the big guys. All right? Now, if you're sensitive to any of those foods, guess what? They're making your condition worse. There's no question about that. So when I ask you what it's worth you to get better, man, what it means is this: is if we do these sensitivity tests and you're sensitive to maybe some of your favorite foods, that means you're probably going to have to remove some of these favorite foods from your diet. And it's going to be hard sometimes, but in the end, it will be worth it. Now, what happens if you're sensitive to any of these foods? Common symptoms are this: you can have chronic pain all over. You can have indigestion. You can have bloating. You can have like frequent loose bowel movements. You can be constipated. You can get mouth ulcers. You can get sores. You can vomit. The list will go on. Okay. Now let's address the ASI test, the adrenal stress index. Now this is basically a saliva test. It's much like a DNA test. And what it's going to do is we're going to measure your what your cortisol levels that's produced by your adrenal glands 4 times a day. And that way we can get at least a pattern of what your cortisol levels are doing. Now, if you suffer from like insomnia, blood sugar issues, thyroid problems, you know, measuring your cortisol is critical. You'll never be able to balance or get the resolution of any of those conditions unless we know what your cortisol levels and we correct that. Now, I can tell you this though. Your cortisol levels can be corrected by specific nutritional protocols. Okay, so that's the metabolic part. Now let's talk about the neurological part. Now, your brain needs fuel and activation. If you give your brain those two things, your brain will get stronger, period. Now, fuel comes in the form of oxygen and glucose. Now, the things that we use in our clinic to make your brain pathway stronger are the following. Number one, oxygen therapy. We do oxygen therapy with everything in our clinic, okay? Because oxygen is fuel for your brain and for your nervous system, and it will make you heal faster. We'll also use exercise with oxygen therapy. That will actually increase the firing of your brain. We'll do some specific brain-based therapy. We may do some calorics, some eye stimulation, some audio stimulation, and a multiple other brain-based therapy techniques. We may use spinal decompression to take pressure off your nerves. Now, once we run the proper tests to determine your specific conditions, we can successfully treat you via proper nutritional and natural protocols, not pharmaceuticals. Now, what I want to talk to you about is priorities, priorities, priorities. Okay? There's a list of priorities we need to go through to make sure that we actually correct your problem. Now, number one priority is this, autoimmunity. If you suffer from an autoimmune condition, that trumps everything. Now that means if you're not immune, we have to correct that first before anything else we do. The second priority is blood sugar. You should function between 85 and 99 to be normal. Okay, if you're not, you're destroying brain cells, you're destroying your neurons. That's not good. Okay, and it's going to affect your brain function. Now, the next one is anemia. Now, anemia will deplete your oxygen for your tissues and your cells, and it also will slow down your metabolism. Next is the gut and liver. All right, remember, gut and liver are the conversion sites for T4, T3. And lastly, fatty acid metabolism. I want you to write this down. Okay. Your brain has to have food to survive, and fatty acid is brain food. Let me repeat that. Fatty acid is brain food. If your brain's not getting it, you're going to have a world of problems. Now, the only way we can find out what pattern you are and how to get you better and to address your condition is to run the proper tests and run the proper nutritional protocols. Now, once again, we treat the individual, we don't treat your diagnosis. That's the only way we'll be able to fix you. Because everybody comes in with different triggers and different problems. Okay, some people have liver, some people don't. Some people have a pituitary and they don't. So we have to treat everyone differently. If I were to treat everyone the same that came into my clinic, guess what? Guess how successful I would be? Terrible. I wouldn't be good at all. Now, what we do is this, is once we get all the information, we can put all the pieces of the puzzle together and we can help get you better faster. Now, what I want you to ask yourself are the following questions. Number one, how has your chronic condition affected your job, your relationships, your finances, your family, or any other activities? Number two, what has your chronic condition cost you in time, money, happiness, or sleep? Number three is, where do you picture yourself in the next 1 to 3 years with your condition if you don't take care of it right now? And number four, what is it worth to you if you could improve your condition? And I mean actually improve and almost get rid of your condition. What is that worth to you? Now, what I want you to do is to call and make an appointment so we can sit down and assess your blood work and do a proper functional neurological exam to figure out how we can add value to your life. Now, here's what you can expect at your appointment. It's going to take about an hour and a half. It does take that long to figure out exactly what's going on with you. Number two is if you're married, we want your spouse there. Okay? You're not going to make decisions for your future and your health without your spouse. And if you intend on staying married, you're just not going to do it without them. So we want them at the exam and at the report of findings when we discuss what we found wrong. At a minimum, we need them at the report of findings, but the exam, we need them there too. Now, also, all paperwork needs to be filled out and completely, because that'll better allow me to assess your health conditions and help you get you better faster. Come in with t-shirt and shorts. I can't do a neurological exam without those, okay? We need access to legs and arms, okay? Last thing you need to do is you really need to watch this DVD. Watch it over and over. It may take you 3, maybe 4 times to actually get what we were discussing with you, okay? And I know it's not going to happen overnight, but I do expect you to understand it, okay? I want to thank you for your time. I look forward to seeing you in my office and allowing us to show you how we can change your life.